to write jam, as I said, off in school. I cannot still do them. It will be so expensive. But I have questions in year 250, depending. So there are three methods in Nigeria to study nursing or to earn a nursing degree. So it's either you go through School of Nursing, or you go through College of Nursing, or you go through the university. All right. So for the School of Nursing is literally a 3-year program. Then for College of Nursing, it lasts for 4 years, and for the university, it lasts for 5 years. So for the School of Nursing, when you're done with your 3 years, you're leaving with your RN license. That is after passing the NMCN exams. You leave with your license and ND, which is National Diploma from that School of Nursing. And if you are going through College of Nursing, you're leaving with HND, which is Higher Diploma or Higher Nigeria Diploma. And if you are finishing from the university, you're leaving with a Bachelor in Nursing Science certificate. So for the School of Nursing and the College of Nursing, these two schools, their main aim is to train you to be a registered nurse. So it's more like straight to the point, so that you'll be able to take your RN exams and then pass by God's grace. So I'm going to move on to the requirements for these various institutions. So for School of Nursing, the main criteria is to have at least 5 credits in mathematics, English, biology, chemistry, and physics. Then from there you go to the School of Nursing, where you find interesting. You pick their form. You definitely pay for their form. You pick the form, and then when it's time for exams, you'll be called to write the exam. And if you pass the exam, or let me say, if you successfully passed the exam, they'll call you for interview, where they'll just ask you basic questions. And then from there you start school. And then when you start school, PTS, then from there they'll weed some people out, and then year 1, 2, 3, when you're done, you write your council exams, off you go, you start work immediately. You just start working immediately. And then for School of Nursing and College of Nursing, they spend more time in the hospital, like on clinical posting. They spend more time. For example, now we have 31 days in a month. People from School of Nursing could go for clinical posting at least 3 weeks in that 31 days, at least 21 days in that 31 days. But they have their calendar. There's a way their school works. From the hospital, they'll come back for their exams and all of that. Yes, they actually spend more time in the hospital for their practical, their clinicals and all. And then in the university, you spend more time in the school. So do you guys understand? Most people will be like, oh, studying nursing in the university is more of theory, and then studying nursing in the School of Nursing is more of practical, But mind you, some schools are different. The school I actually attended, nursing, in short, my nursing experience was the very best. I do not have any reason to how do I put it? We were all good. I feel like it depends on the school. We were all good, to the extent that even when I started my internship, I did so well, and I didn't even feel like someone that came out from university, because it'll be like, okay, this person is coming out from the university, you know more of the theory. Anything they'll ask you, you'll be able to answer. Well, can you work with your hands? Do you understand? So that is how it works. So this is more like an advice. If you are going to the university, try your best. The little time you get to spend in the hospital, open your ear, open your ears, open your eye. Open your eye, be very sharp, learn. There's nothing you will not know. Someone that goes to the hospital every day for posting, and you that goes for 2 weeks, if you decide to know even more than the person, I promise you will know more than the person. So this thing is just individual. Do you understand? It just depends on you. If you know, okay, you want to go to the hospital, you want to learn what you're supposed to learn in 2 weeks, you don't want to learn extra, that's your problem. There is another person that actually wants to learn extra. Do you understand? So, but truth be told, people from School of Nursing spend more time in the hospital compared to people from the university. That is why we do internship after the university. So there is nothing to be scared of. Don't be scared that, oh, you might not know those procedures as much as they do. My dear, you do 1 year of internship, you will know everything, and you'll be like a baba. You'll be like the oba of nursing. Trust me. Right after the university internship, you'll be so good. Like, this is a promise, you'll be so good. I don't think there's anyone that has passed through internship that'll come and tell you, oh, those things I was scared of in school, I cannot still do them. It's not possible, please. It is not possible. But you never can tell. But personally, I don't think it is possible. For the College of Nursing, it's almost like the university, but they study for 4 years. College of Nursing, you have to write your JAM first. You have to write your JAM and write your WAEC. And College of Nursing, you just get right into year 1, year 2, year 3, and year 4. Nobody is going to tell you, oh, come and write PTS. No, it's straight to the point. And at the end of that 4 years, you're getting your HND, Higher National Diploma, and you're living with your RN license. That is after passing your NMCN examination. And right after that, you go for 1 year service. After service, you get your certificate, and then you start work immediately. So for the university is 5 years. It lasts for 5 years, 10 semesters. 5 years, 10 semesters, year 1, 2, 3, 4, and 5. So right after these 5 years of study, you go for internship. That is after, let me explain this properly. So when you're done with this, your 10 semesters in the university, and just so you know, within these 10 semesters in the university, you could actually take these professional exams in your 400 level, in your 500 level, and if possible, in your 300 level. Yes. So before the main exam, there is an exam they call the pre-council, which they will use to qualify you to write the main exam. And then when you pass the main exam, you're going to get your RN license, and after school you'll be inducted into the Nursing and Midwifery Council of Nigeria. After the induction and everything, you move on to apply for internship in any state of your choice and in any federal hospital of your choice, which is for 1 year. So that 1 year is mainly going to inculcate you, educate you more on the practical aspect, because they believe that people that went through university spend more of their time in school, within the school block and all of that. So this internship is more like a program to help you gain what you were never really opportune to gain. So if you want to know more about internship, I recently dropped a video on this channel. You can always go back to check, and if you want me to say something more about internship, you can always drop a comment here, and I'm going to film another video for that. So right after your 1 year internship, when you're done, you get your original license, like the main license from your school, because this internship, they have like criteria. There's some books to sign, log books and all of that. So before you go for service, you have to make sure to do this internship so that you get your license, your main original license from your school. Before you even go for service, you must have had your license. So right after your internship, you go for service, and after service you can start working. And once you are done with this BSc internship service, you'll be fully employed. All right, but if you are coming straight from School of Nursing, they'll absorb you immediately if they actually have space to employ, or you could always apply for a job and you'll be employed. But College of Nursing, you will need to go for service first before you can even apply for employment. And then, as I said, for Bachelor of Nursing Science, you will need to go for 1 year internship, and you will need to go for your service first before you can get employed. So moving on, I'm going to talk about the rank or the ranking or the way they rank after these various institutions, like when you are done with them. So if you finish from School of Nursing and you pass your NMCN examination and you get your license and you get employed, you start from being a nursing officer. Same thing goes with College of Nursing. So the highest of them all is Bachelor of Nursing Science. So when you are done with the university, you are done with your internship, in short, automatically if you go to the university, you are a senior nursing officer. So let me just give you a quick rank of nursing. So we have the nursing officer here, we have the nursing officer 1, nursing officer 2, then we have the SNO, which is the senior nursing officer, then we now have the PNO, which is principal nursing officer, then we have ACNO, which is assistant chief nursing officer, then we now have the CNO, which is chief nursing officer. After CNO we have AD, which is assistant director. Then from there we now have the DD, deputy director, and then we now have the DNS, which is the director of nursing services, the highest rank that can be held by a nurse. So if you come straight from School of Nursing, you start from being a nursing officer. Then with time, every 3 years you get your promotion. But notwithstanding, you can always go back to the university, then start as a direct entry student. You start with your year 2, and within 4 years, by God's grace, without strike, you'll be done with school, and from there you get to be a senior nursing officer, and then in subsequent times you get promoted. So as for the courses in School of Nursing, remember what I said, you start with the PTS, and then from there your year 1 is just those basic courses, the ones you did in secondary school, like biology, physics, chemistry, mathematics. And okay, for School of Nursing, they could actually include something like Foundation of Nursing. Yes, it's very possible. I did not attend School of Nursing or College of Nursing, so I went to the university, and I can actually list out the courses that you do from your first year to your last year. So for the first semester, year 1, year 1 starts with those basic courses, biology, physics. For university, year 1, you're going to do biology, physics, chemistry, mathematics, all those GSS, maybe anti-corruption, English, French, and all of that. And most likely Foundation of Nursing. They're supposed to introduce that. Okay, no, there will be no Foundation of Nursing then. And then in year 2, there is Foundation of Nursing Science, anatomy, general histology, general and systemic embryology, entrepreneurship and innovation, biochemistry, physiology of excitable tissues, and cardiovascular physiology. And then for the 3rd year, I'm just mixing this, I'm not specifying if it's first semester or second semester. For the 3rd year, we have epidemiology, we have gynecological nursing, there is cellular pathology, there is basic medical surgical nursing 1, basic medical surgical nursing 2, basic maternal, newborn and child health nursing, mostly midwifery. There is basic primary health care, there is clinical pharmacology, there is entrepreneurial studies 1, there is nursing ethics and jurisprudence, we have basic mental and psychiatry. And then for year 4, there is advanced medical surgical nursing, there is advanced medical surgical nursing 2. Okay, the first one was 1, then this one 2. There is advanced maternal, newborn and child health, there is research methods, there is principles of education and teaching methodology. We also have basic community health nursing, hematology and clinical pathology, introduction to political science. Yeah. And then for year 5, mainly specialty area, we have oncology and palliative nursing. There is research projects, that's where you have to do your research and all of that. There is clinical elective, nursing seminar, and then health economics. So those are more like the main courses that every student in the university is going to study. So everything differs. It depends on the university you go to, but that was what we did in my school, and that is currently what they are doing in my school for the courses. So as for the School of Nursing and College of Nursing, as I said, for year 1, that's after PTS, it's mainly the basic courses. Then in year 2, they'll do more of the anatomy, physiology, just like us, but they'll spend more time in the clinical area. So people usually ask about which of these institution is more hard or requires most of your time. I'm going to say I cannot really specify, alright? I cannot really pick, because if I pick now it will sound like I am biased or anything. But you see, university, in year 1 as a nursing student, you are free to do whatever you like. You can go to class with your hair like this, you can fix your nail, do your makeup, nobody is stopping you. But School of Nursing is different from your year 1. No earring like this, no fixing of nails. They put on their uniform from Monday to Friday. When it comes to the university, for your year 1, you are as free as, should I say, you're as free as a fly, because you've not started doing your departmental courses, and even by then you might not even know your HOD, so you're just moving on with every other student that is studying microbiology, physiology. Do you understand? Year 1 is like that free year where you can fix your nail and do all of that. But when you get to year 2, that is where anatomy starts. This hair on my head, you might not take it to class, because by then you start doing foundation of nursing and all. So you're not expected to wear earrings like this to class and all of that. And then from that year 2, you most likely start your clinical posting, where you'll be exposed to the hospital. And as you're going with your uniform, so you'll be posted to mainly medical and surgical wards. Then with time, you get posted to other wards. And then as for the pay, obviously, anyone who comes out from the university and is done with internship, is done with service, will definitely earn higher than someone that just came out from School of Nursing or College of Nursing. That is how it is. And also promotion and all. Do you understand? So I could finish my Bachelor of Nursing Science this year, go for internship 1 year, go for service, and then once I'm done, I'm a senior nursing officer. Remember the ranking I did earlier? I'm a senior nursing officer, and in 3 years time I'll be promoted to be a principal nursing officer, and then I'll get promoted more and more in subsequent time. So it's different with School of Nursing. And then this School of Nursing and College of Nursing actually limits you from some certain things. Yes, to be honest, if you don't have a bachelor in nursing science, if you've not done your masters, there is no way you can be the HOD of any hospital. It's not possible. Do you understand? It's not possible. I'm not trying to be biased or anything, but that is how it works. You need to be advanced in this profession for you to be able to hold some certain let me not use the word rank. For you to get into some certain offices, you have to be advanced. If you're already in School of Nursing or College of Nursing, there is no problem. That is totally fine. That is perfect. When you're done, you can always spend 2 years working, then you jackpot. If you want to stay in Nigeria, you can start work. Yes, you can start making money. And I must advise, as you're working, just look for a way to get into the university so that you get promoted on time and you earn more. Alright, you earn more. And also, if you are in School of Nursing or College of Nursing, you are actually going to get how do I put it? You have a better advantage, because from there now you go to the university. So you have enough and more than enough knowledge up here, and do you understand? You'll be able to scale through the university perfectly, and you could even be working while going to the university. Yes, you could be working. That's very possible, 100% possible. I have friends that finished from School of Nursing and they're currently working while they are trying to get their Bachelor of Nursing Science degree. But if you've not started nursing yet and you're like, okay, I want to do nursing, take this message from me. Try your best to write JAM. Go into the university, start from year 1 and then finish. Instead of going to School of Nursing or College of Nursing, or you feel you don't really have so much time, anyone that favors you, because most times people that are in School of Nursing, maybe they wanted to go to university but did not really work out well for them as planned. Do you understand? So anyhow the Spirit leads you, at the end of the day we are all registered nurses. But remember the ranking and the pay. Me that finished from university and someone else that finished from School of Nursing, we can never earn the same thing. We cannot. We'll definitely get promoted. But when it comes to cost, I don't know which is more expensive. I really don't know, because School of Nursing is for 3 years, College of Nursing is for 4 years, and Bachelor of Nursing Science is for 5 years. But some people always say School of Nursing is more expensive. Some people will say, oh, you spend more money in the university. Some people will say, oh, you spend money on College of Nursing. But this is more like monopoly. So everyone will definitely have their say. My experience in the university might not be the same experience that you have. Yes, and the amount of money I might spend in my school will not be the same amount of money that you spend in your school. Yes, so I really can't pick out which one is more expensive, which one is more. I really can't pick at this point. But it depends on if you go to the university and it's actually a private university. Obviously you will spend more, even more than anyone in federal school will spend. All right, but I really can't tell. Even same with School of Nursing, there's some schools that will spend more. Yes, School of Nursing is under Federal Ministry of Health. It's not supposed to be. Personally, I don't think it's supposed to be so expensive to university. As I then know, I would say, let me not say, because university is 5 years. So if you want to add up these 5 years, it will almost be equivalent to the money you spend in School of Nursing. It's almost the same thing. All right, it's almost the same thing. So anyone that works for you, but some people will be like, oh, School of Nursing is more affordable because in 3 years time, that's 3 years with dedication, not anyhow 3 years. 3 years of dedication, because that is the only way. If you don't pass your council exam, you go nowhere. You come back and you resit the same exam again till you pass. So if you got to the end of this video and you're seeing my face for the first time, thank you so much. So make sure to subscribe, make sure to like, and make sure to share with your friend that wants to study nursing and is so curious on how to start and where to start from. And if you want to connect with me, my link is just on the description box. See you guys in my next video. Bye.